Good evening to all the distinguished participants. It is my privilege to extend a warm welcome to each of you as we begin the second day of International Faculty Development Program on Human Engineering for Psychological Well-being. Today's topic is Social Media Use and Mental Well-being, an AA Perspective by Dr. Noorul Hasan, psychiatrist. I wish that you are eager to engage in today's presentation and discussion. Let us remain silent for a short prayer. Gracious God, we thank you for the gift of this day and the opportunity to gather together. Bless us with wisdom, peace, and guidance in all our endeavors. May we strive to do good and be a light to those around us. Thank you. Now I invite Ms. Christiba, Assistant Professor of the Department of Counseling Psychology, to introduce the resource person.
Good evening, everyone. It's my immense pleasure to introduce our resource person, Dr. Noorul Hasan. He has completed his MBBS from Tuticorin Medical College in the year 2015. He completed his MD Psychiatry from prestigious NIMHANS University, the nation's apex institute for treating neurological and psychiatric disorders and neuroscience research. He has been an active part of NIMHANS Community Psychiatry Wing in the year 2020. His areas of interest includes OCODs, geriatric psychiatry, development and genetics, and psychotherapy. He has national level publications and had written book chapters under MOH FW. He has presented many posters, papers at national and international conferences. Dr. Noorul Hasan has done more than 100 academic and community level presentations in the last 2 years. Currently, he is the consultant at Alpha Mind Care Center, Palamkote, guest lecturer to two arts and science colleges for psychology. He is the clinical coordinator for Manidam Foundation clinics at Melapalayam, which is a 10 rupees Janta clinic being run by the trust for affordable first line medical care. We are happy to have you, Doctor. Over to you.
Thank you. Thank you for the great introduction. I don't know how much I deserve this introduction. Thank you, Christiba. And at the onset itself, I show my gratitude for considering me in this great forum in International Faculty Development Program being conducted by the St. Joseph College. And I show my gratitude to the HOD. With that, I start my session on social media use and mental being through an artificial intelligence lens. Okay, so does my slide visible? Yeah. So I am splitting my presentation into three parts. The part one, I will go into a little bit introduction about the general psychiatry and addiction. And the part two, the social media addiction, how it is different from the normal addiction when compared to alcohol or other substance use. And third part, we will discuss something about artificial intelligence, which is running at the background of making someone addictive for the social media. So in that we will split our presentation into three parts. Now let us move. So since the time immemorial, only three things were considered as the medical or surgical illness. So number one, the fever. Okay, since time immemorial, when the atom reaches the earth. So the most common medical ailments or disorders which need treatment were number one, the fever. The number two, the injuries, because world has seen many warfares in the past and in the present also. And the third thing, that is the maternal and obstetric care. Okay, this is the phase one of the medical evolution. And the phase two, so people started developing internal and external therapies through Ayurvedic or plant-based medicines and surgical therapies, be it the Indian-based Sushruta or from the Persian level of medical system. This is the second phase of the medical evolution. And So whatever we see, whatever we listen from the history, we will observe things in our examination, okay, in a clinical or physical examination. We will pick out the external and internal signs, then we will devise treatments through internal and external therapies via medicines and surgical therapies. This is the initial level of medical evolution. Then later, so till now, we have seen or observed some change in the body. Then we have tried our level best to derive the medicines. Then third phase was we tend to observe what would be the pathology behind any illness. So this is that era where we have tried to develop blood investigation, serological investigation, imaging studies until the genetic studies. Okay, this is the third phase of the medical evolution. But what happens in terms of psychiatry, we are still stuck with the paper pencil work in terms of listening the history in detail, then making our diagnosis according to the classification system. See, if you go back, we can, so by touching someone, we can diagnose a fever. By understanding or examining someone, we can find some lump or surgical illness. But for psychiatry, we are still stuck up with the paper pencil work or the clinical interview. For example, so here is a person. So if the doctor is not wearing any code, then we will not be able to actually differentiate who is the doctor and who is the patient, because psychiatry doesn't produce any visible or injurious external signs. So the patient here so looks like almost similar to the doctor, but his thought process might be different like this. So in psychiatry, instead of relying upon the investigation, we rely more upon the clinical interview to understand the thought process of the human being in order to diagnose and appropriately treat the human being. So this is the era where psychiatry still stuck up with the clinical interview for diagnosis and treatment, unlike other medical specialties. Now, so for diagnosing psychiatric illness, so we don't need any blood investigation or high level serological investigations or genetics. Rather, we need to understand thoroughly about the classification system. So for example, if I am diagnosing someone with schizophrenia or depression here, that should be almost equal to diagnosing depression or schizophrenia in the other corner of the world. So for that similarity, the world has unanimously following this classification system in order to accurately diagnose the particular illness in order to treat them with appropriate medications. So this is the era of psychiatry. Okay, now we will try to classify psychiatric disorders in these headings. See, I'm actually kind of violating some of the basic rules of classification. Here I'm trying to classify psychiatry in my most convenient way in order to aid that in a clinical examination. So now the number one, the neurotic disorders. So this includes anxiety and depressive disorders and OCD. Then the psychotic disorders. So here it involves schizophrenia and bipolar disorder, especially bipolar mania in this. And third group of classification is called addictive disorders. This is what we are going to discuss in the another 40 minutes. Okay. And the third group of illness called personality disorders. மக்களுக்கு வந்து சுபாவம் இருக்கும். அந்த சுபாவமே தன்னுடைய பயாலஜிக்கல் சோஷியல் அண்ட் ஆக்குபேஷனல் ஃபங்க்ஷனிங்க கம்ப்ளீட்டா டிஸ்டர்ப் பண்ற அளவுக்கு ஆயிடுச்சுன்னா then we call that personality as a personality disorder. It has many types, as people know. And the last one is the developmental and degenerative disorders. In terms of development, you know, the intellectual disability, autism, and other things. And in terms of degenerative disorder, we have dementia and other illness in the later age group. So this is the very basic classification of psychiatric disorders. So now we will focus more on the addictive disorders because which is the focus of our discussion today. Now, substance addiction. So how do we define a drug? A drug is any chemical substance other than food which can change the way the body or mind functions, and it can distort the auditory, sensory, and other visual sensations. This is how we will define a drug. So நமக்கு தெரியும் alcohol is a drug, smoking is a drug, then other medication, benzodiazepine, other opioid, heroin, cannabis, marijuana, all are drugs, and it has an active molecule in it. So with that active molecule, it will exert a neurobiological effect on the brain. Okay, so this is how we define a drug. Now, so alcohol, if you take alcohol, there's something called ethanol in it. So which is called the active molecule. For example, if you take cannabis, That is called tetrahydrocannabinol, which is the active molecule in it. Okay, so the active molecule in the substance, that is the alcohol or any other substance, acts by two ways. The number one, it acts by CNS inhibition, that is inhibiting the central nervous system in order to produce a calming effect. This is one way of action. Number two, it acts by CNS stimulation, producing positive sensory changes and something called euphoria or exalted happiness. Okay, so after consuming this kind of drugs, a human by nature develop a habit for using the drug again and again. There are some group of people, okay, they will cope their stress or the issues by eating something from food, from hotel. Like that, they will try to cope their stress by taking the substance and again. This is called maladaptive coping. There are some people, in order to quench their the boredom or kind of an emotional dysregulation, they will try to have the drugs again and again. This is called in order to quench the affect hunger. For this three reasons, people try to consume the drugs again and again. So after taking the drugs for some time, what will happen? So yeah, a person of 30 years old has taken alcohol for some time, for 6 months, for about 1/4 a day. Now it has been 6 months. Now he will not be able to live without the substance. So what he developed is he will develop an irresistible urge to have the drug again and again. After some time, ஸோ ஒரு குவார்டர்ல ஆரம்பிச்சேன் சார், அப்புறம் 2 குவார்டர் ஆச்சு, 2 வருஷத்துக்கு அப்புறம் நான் இப்போ ஒரு 3 குவார்டர் குடிக்கிறேன், 4 குவார்டர் குடிக்கிறேன்னு சொல்லுவாங்க. தட் மீன்ஸ் பழைய டோஸ் அவங்களுக்கு கொடுத்த ஒரு எஃபெக்ட் இப்போ ஒரு அதே டோஸ் இப்போ கிடைக்க மாட்டேங்குது. அதே டோஸ்னுடைய எஃபெக்ட் இப்போ கிடைக்கும். ஸோ ஹி டென் டு இன்க்ரீஸ் தி ஆல்கஹால் டோஸ் பை டியூரேஷன். திஸ் இஸ் கால்ட் டாலரன்ஸ். ஸோ whenever he stops during the time of festival or மாலை போடும்போது they will stop, they will develop withdrawal symptoms. So like that, patient will develop craving, tolerance, withdrawal symptoms, loss of control. So they will not be able to mediate or control the initiation of usage or the completion of usage. And even after having significant physical disturbances with the drug, they will further tend to use a drug again and again. These are the 6 criteria to understand whether the patient got addicted to a particular drug or not. For example, there are 6 criteria. If someone satisfies 3 criteria for a duration of 6 months or 1 year, then we will call them as addict. Okay. Now, I am just extrapolating the same discussion again in this consort. Okay. For example, a man uses a drug initially by experimentation. Later, he uses the same drug for entertainment and also as a coping mechanism. So this drug has an active metabolite in it, active molecule in it, right? That molecule will act on the reward system, especially in the dopaminergic and the glutamate system, okay, in order to produce a calming effect or an euphoric effect. Okay, so but this effect will not be lost long. Okay, so because the compensatory mechanisms to combat the same effect produced by the drug will be fastly done. For example, euphoria will not sustain for a long time because of the compensatory mechanism that God has created within our brain. Okay, but with the recurrent use, there will not be any compensatory mechanism. Rather, our brain slowly adapts for the drug after recurrent usage. Okay, that means later it leads to a state called where normalcy is achieved only with the help of substance on daily intake. This is the stage 1 of addiction. Okay, and second thing, whenever he misses a drug, he will develop a very bad mood or feel restless or withdrawal. This is the second phase of a stage of addiction. And later, what happens? The brain will slowly adapt with the presence of substance. So without substance, he may not be able to live a normal life. Okay, that means the neurons get slowly adapted to the substance. So this is called maladaptation or the aberrant neuroplasticity, we will call in the neurological terms. So what happens? So if that state is attained, the neuronal system will be always longing for the substance, waiting for the substance to have it to maintain the normalcy. So they will be always in the preoccupation and anticipation of having the substance again and again. Okay. Until now, people are following me. Is there any confusion? Oh, so note here, there is an active metabolite in the drug. which is causing all these stages of addiction. Now, until now, one point is clear. There is an active molecule in the substance taken. Number two, that is interacting with the neurological system. And number three, it produces calming or euphoric effect. Correct? Now, we will go to this consort. It's a very interesting consort. Okay. Here, there is no active molecule, but still people can, okay, but it can affect the reward system. That means reward system in the brain, which is causing a calming effect or a happiness effect. Okay. And further, it leads to the blending of the compensating mechanism, and people will be continuously using. Without that, they will not be able to live a normal life. Rather, if they are unable to consume or do that activity, they will be developing a withdrawal or negative effect that will again lead to aberrant neuroplasticity and the same third stage of addiction. Here, one interesting thing is, see the first part, there is no active molecule. So here, we slowly extend the discussion to the social media addiction or internet addiction. So in internet addiction, is there anything, any active molecule which is entering our brain through the screens? Is there anything like that? No, but still people will go through all this kind of stages and they will slowly get addicted. So this is very interesting for the psychologist. So by doing therapy, okay, just a talk therapy, by understanding, eliciting their aberrant cognitive errors, and we are replacing with the healthy cognitions, thereby we are doing a cognitive behavioral therapy that also makes a healthy neuroplasticity in the brain. Are you following me? So even with our words also, this kind of good neuroplasticity can be produced through the therapy itself. This is a very good example. For by using social media, people are getting addicted to the gaming, but they are not getting any active substance from it, but still they're getting addicted. So if you can apply the same thing positively for your psychotherapy, through our words itself, we may be able to establish a healthy neuroplasticity or healthy adaptation in the neurological system. Very, very important inference to take. Okay, even without the molecule, also someone can get addicted to something. Right now, social media. Okay, so now we are just introducing ourselves into social media. So we know after the child was born, okay, the child development is being modified by these three factors. Number one, the parenting and the type of attachment to the surrounding. Number two, the environmental influence. And number three, the genetics, religion, moral, and ethics. These are the three things which actually alters or aids in the development of any human being. And in the current day, especially for the Gen Z or the Gen Z's children, there is a fourth modifying factor called social media, because you can very well know, even my child or your child, after reaching the 9 months old, what does it do? Choo Choo TV, right? Then Coco Melon, Chutti Kannamma. These are all the social media platforms, right? So after our parenting, our environmental influence, or the religion, moral, and ethics, the child gets developmental input from the social media network. So I can call this as the fourth modifying factor for any development of a child. So this is so the social media nowadays is playing a very much active role in our developmental process and in defining our thought process and also in defining our worldview. So now let us move further. So initially we have discussed some of the illness like schizophrenia. Those were there since time immemorial when the man reaches the earth. But disorder, the disorder that we are going to discuss in terms of internet addiction or social media addiction, these are not there in the initial time. If we trace to 30 or 40 years back, okay, we may not be able to find this kind of addictions in the world, right? So these are the disorders of human advancements because of the four things. Number one, the technological advancement and pervasive penetration into our personal life. Number one. And number two, the high-speed internet availability. Number three, the excess socio-centricity. That means now வெளியே ஒரு டைம் நான் பார்க்கணும்னா I can meet only 2 to 3 friends in a day, but if I log into a Facebook or Instagram account, I can see 1,000 friends in a day. I can communicate with 1,000 people in a moment or a day, right? I can send a group message to all the 500 people at the same time. So that's called the excess socio-centricity. And the fourth one is device portability. So these four things make ourselves much more dependent to the social media forum than any time before. Okay, now, so what is called internet addiction? Internet addiction has six components or six types. Number one, gaming addiction. Number two, the information overload. Number three, the computer or gadget addiction. Number three, cyber sexual addiction, that includes pornography and other things. And number five, cyber relationship addiction. Okay, so I have to say something from a clinical kind of experience. There was one patient, okay, of mine. So he has later, he initially developed a habit of masturbation in the past. Then he slowly entered into the pornography addiction. Later, he entered into the addiction, something called, there was a social forum where people chat with nudity. So they will share their nude picture among the group, and they will kind of try to gratify themselves later. So this is a kind of very novel type of cyber sexual addiction, which we can very well see nowadays from the patients. And the fifth one is cyber relationship addiction, and the last one is called the social media addiction. Okay, so now we will discuss something related to social media addiction from now on. So what are social media? So the SNS mean the social network sites, okay, and you can interchangeably use that SNS for social media, okay. So there are applications of social and network sites. For example, wikis, forums. For wikis, that means reading. For forum, blogs, then massively multiplayer online role playing game that we know. So MMORPGs, then online gambling, content sharing communities, online dating, messengers, social networking sites. So we are all aware of this sites called Wikipedia, Reddit, Quora, Tumblr, WordPress, World of Warcraft, PUBG, Fortnite, Betway, Online Rummy, YouTube, Pinterest, SlideShare, and most commonly used things are so for as a messenger, WhatsApp, Snapchat, and Telegram are most commonly used, and latest social networking sites called Facebook, Instagram, Twitter, and LinkedIn. So these are the most common available social media network sites in our current times. So among them, the most commonly used social media is for in terms of the young older adults, the Facebook and YouTube are the most common social media network used by the elder adults. That means above the age of 30. But in terms of younger adults below 29, Instagram, Snapchat, TikTok are the most common social network sites being used. Okay, so the prevalence ranges from, in a nutshell, 20 to 46 percentage in the adult population. This is high prevalence. Okay, for example, if you keep the cutoff for a moderate level of addiction, then the cutoff will go to 25. 45, but we keep the severity to the severe level, then it will go down to 25. So in a nutshell, the prevalence ranges between 20 to 46 percentage. Okay, and very importantly, overall 20 percentage in school students. Okay, especially after the COVID lockdown and all, for communication, entertainment, and knowledge sharing, this network's usage has been significantly catalyzed over the last 3 years. Anyway, data is a data. Now we will slowly move into the core part of the social media addiction. So what is social media addiction? How will we define social media addiction? By the definition coined by the Anderson and Ellison. Okay, so we have four criteria to call someone has social media addiction. The number one, being overly concerned with social network sites. Number two, driven by a strong motivation or crave to use the media again and again. Number three, devote so much time and effort for it. Number four, this effort, this preoccupation, this consistent usage of social media leads to impairment of biological, social, and occupational functioning and affects the mental well-being. So if someone kind of satisfies this four criteria, we can very well call them as addicted to social media. Okay, without that, we may not be able to call as a addict. Rather, yeah, kind of overuse or kind of an harmful use, we can call in that way. So this is very important slide. Okay, so someone called Reed Hastings, the CEO of Netflix, once said, there are three competitors, the die-hard competitors in the world. So one competes with the other competes with the insurance. For example, the YouTube, Facebook media, and the human sleep. These are the three competitors and the dangerous competitors of the current world. For example, I was about to sleep. Suddenly, I receive a message in the WhatsApp. Okay, it is actually a YouTube link. So now I am actually started seeing one video of some very recently released movie or a trailer or teaser. Maybe the goat trailer, goat teaser got released. So I am seeing that video on YouTube. Suddenly I got a notification from my friend in the Facebook. So I am just entering the Facebook. Then again I thought of seeing a video in the YouTube. So I am shifting between one to one, YouTube to Facebook, Facebook to YouTube. Finally, I am sleeping at 4:30 and I am just waking myself at 7:30 and coming to the work like a zombie without any sleep in the night. So these are the three important competitors which is killing our night sleep. Okay. Now, so what are the six core components of behavioral addiction? Okay, number one, the tolerance. So this is almost similar to the other alcohol or kind of other substance addiction, except the two things. Number one, the mood modification produced by the overuse of social media or internet. Second thing, conflict produced by the social media. That means the mood modification means there will be a significant rush to use. குழந்தைக்கு மொபைல் கொடுக்காட்டா என்ன ஆகுது? It will throw significant random. It will tend to beat the mother, bite the siblings if sibling is not giving the phone to the child. So this is called arousing rush, numbing, completely indifferent to the environment, tranquilizing escape provided by the behavior itself. This is called mood modification, and this consistent use of social media will lead to conflict within the person and with the person also. So these are the two new criteria specifically added in terms of the behavioral addiction. So these are the six components of behavioral addictions. Number one, tolerance, withdrawal, mood modification, salience, conflicts, and relapse. And there's one new term called FOMO, the fear of missing out. So இப்போ ஒருவேளை நீங்க நம்ம எல்லாருமே வந்து, for example, if I stopped using Facebook from now, what I will feel? By night, I feel like, oh, so there should be some kind of an present event, the famous event being shared in the Facebook, but I am not aware of that. So I will feel that I am missing some good content which is being shared in the Facebook. This is called fear of missing out. I will not only feel that I am missing the information, rather I will feel that other people are gathering that information, consuming that information so much, but I am not getting information. I am becoming ignorant by lagging the current scenario concept of the world. So this is called FOMO effect or fear of missing out. So as soon as you stop using social media, you will get this kind of feeling, FOMO, right? Fear of missing out some information. So then diagnosis of social media addiction actually, like schizophrenia or bipolar disorder, we don't have a standard criteria for social media addiction. Rather, we are extrapolating the same criteria from the other substance disorder or from the internet addiction person. Okay, so what are the rating scales to assess the severity of the kind of social media usage, which is based on the compulsive use of the media, negative outcomes produced by the media, and withdrawal symptoms created by that media. So we have many scales to assess that. You can actually go through my slides for this. Now we are entering into the AA part slowly. So this is one of the study, Ansky theory, which was released in 2022 August. So what does it say is, these are the behavioral changes produced by the excess use of internet or social media. Okay, for example, people are getting admitted with some kind of illness, but none of them have a syndromic illness like depression, bipolar disorder. We are not getting that kind of syndromic illness. Rather, we are getting so much of an behavioral changes happening in the children. So if we actually draw a long-term curve, there was a particular time in the long-term curve where the USA got significant amount of child admission to the psychiatric hospital. So that was at the time of 2010, and that 2010 exactly correlates with the invention of the kind of Orkut or the Facebook media. Okay, so the social media makes significant behavioral problems in the childhood. So this is the example for that. So this is one of my patient. Okay, she was using the social media for a very long time. By every week or by every third day or fourth day, this child used to share her cute photo, okay, in the social media. So people tend to prize the photo. People tend to kind of positively comment upon the photo. At one point of time, one of the close friend told, your ears could have been a little longer. That's how they told. So after reading that comment multiple times, this child slowly developed something called and my ears are very small. So child tends to gaze at the mirror continuously, and she came to me with the complaint that doctor, I have very small ears and I have very small nose, small chin. So slowly, a small comment from the social media after sharing an image lead to something, a syndromic disorder called body dysmorphic disorder. We call that as a BDD. So social media, though it is not a substance, though it doesn't have active molecule to create or create an aberrance in the neurology, in the neurocircuitry, but still it can cause a syndromic illness through its kind of linguistic effects itself. So these are very important things to know. And I have another case. Yesterday only I have seen this patient. So he is a kind of anxious, avoidant person. He tend to internalize others suffering so much. So he has a habit of following one group which updates about death and news about the demise of someone in the native. So, for example, they have one WhatsApp group. They will continuously update this man of age passed away because of this illness yesterday, today, this time. So he was following in that group continuously. Slowly he developed. So, hey, what man? ஒரு 40 வயசு ஃப்ரெண்டு என் வயசுல ஒரு பையன் இறந்து போயிட்டான் and he suddenly developed a cardiac arrest. After internalizing, consuming so much of this kind of an illness information, he slowly started developing something called hypochondriacal disorders. Actually, he visited totally 32 doctors before seeing me. So I was the 33rd doctor because he internalized so much, he misinterpreted many of his kind of symptoms, and he will go to the particular specialist in order to diagnose whether I am getting a kind of heart attack or not, or kind of cancer in my stomach or not. So this kind of after internalizing this kind of information in the WhatsApp media, he developed something called hypochondriacal disorder. So social media is now it's a kind of a black hole which produces significant amount of illness in the human minds. So now we will enter into the etiopathogenesis. There are many theories in order to understand the etiopathogenesis of the illness. Number one, the attachment theory, learning theory, cognitive behavior theory, neurocognitive model. Excuse me?
Excuse me, sir.
Yes.
There are participants from other states, so
Yeah.
they cannot understand Tamil.
Yeah.
Okay, thank you.
I understand. Yeah, I mean, very local example. I'm speaking.
Sure.
I am just following in English more. Yeah. So these are some of the theories which can actually, with which I will be able to understand the pathogenesis of social media addiction. So number one, the attachment theory. Number two, the learning theory, and the cognitive behavioral theory, neurocognitive model, motivation model, and something called the I-PACE model. That means the interaction between personality factors, affective states, cognitive responses, and executive dysfunction. So these are the kind of very basic theories in order to understand how this social media addiction emerges. But what is actually happening in the beginning in order to amplify the usage of social media to become an addict? So for that, we are going to discuss something about artificial intelligence. Now, so yeah. So artificial intelligence. So I will give a very brief introduction and understanding about the artificial intelligence. Then I will extrapolate the discussion to how the AI aids in maintenance of social media addiction in a particular individual. That's how we will continue the discussion. We are now in the third part of our discussion. So machines are artificially incorporated with human-like intelligence. That's point number one. Number two, to perform tasks with better proficiency and skills. This is achieved by infusion of knowledge to the machine through complex algorithms and mathematical functions via complex neural networks. We have two types of complex neural networks. One is called the recurrent neural network, and second thing is called the convoluted neural network. These are the basics of artificial intelligence, how the machine learning is happening. Now, so there is something, so we have 6 cognitive domains, and one domain is called executive function. So executive function involves the working memory, self-monitoring, planning and prioritizing, decision-making, organization of a task, impulse control, and emotion control. So this all incorporates something called executive function. Okay. Now, here a machine utilizes this capability of executive function with significant machine learning in order to exert a particular output or function as like human or much better than human execution. So this is what the machine learning does. So what are the core important components of artificial intelligence? Number one, for a machine to work effectively in order to produce a particular output, it needs three type of components. Number one, generalized learning, which is called adaptation. Number two, it has to utilize the given inputs according to the demand. So that called reasoning. So machine only will do the learning, machine only will do the reasoning, and machine only will do the problem solving. So these are the core components of artificial intelligence. Then there are four parameters. So how this artificial intelligence is being executed in order to produce an outcome. Number one, so after kind of giving a data, after particular machine learning, we are just giving the data as input to the machine. It perceives the data, it learns and picks up the particular pattern, it abstracts an idea from the pattern, and it reasons, and then it gives an output. So that's how stage-wise an artificial intelligence or a machine learning assesses a particular data and given outcome to the receiver. So these are the important parameters of artificial intelligence or machine learning. Now, so what actually it does? So number one, here is a human. So he was given a difficult task. So with his cognitive ability or problem solving ability, he is establishing a solution. Okay. Now the same task is given to the machine. A difficult task is given to a machine after continuous persistent learning. Okay. Through the concept of generalized learning or reasoning or abstracting, the machine gives a solution as like human being or the way far ahead than human being. Okay. So this is called machine learning. So which makes the human life easier. For example, and the best example is the statistics, right? For example, people who are above 50 years, when they were doing their kind of a PhD, I mean, 20 years back, they have to do a paper pencil type of a statistics. But now we are using SPSS or model to compute our statistical data, right? So this is the exact example of what machine learning does. So the machine learning not only simply analyzing a data, rather it reasons, it abstracts and give a much reasonable output as like the human being, right? This is called the machine learning or artificial intelligence. The intelligence which is received by the machine through machine learning, and it can give output as like human being with a very delicate abstract. So there are three waves in artificial intelligence. The number one is the handcrafted knowledge. Number two, the statistical learning, and number three, contextual adaptation. So we are not going to deep into this matter because we lose connectivity with the presentation because there are very too much technical terms. Now, I will go on to one important concept. For example, so there is a machine. Okay, so I am just giving a data to the machine. So data. The layer one, okay, extracts the basic understanding of the person. The layer two, identify the unique features, okay, by reviewing the past data about the person. The layer three recognizes a particular pattern in the data and compares with the other data available. And the layer four, which personalized feeds, it gives kind of a feedback or idea to the subscriber. And number four, machine executive function depend upon the task given as an input. Okay, so this is how, like a human being, like our frontal lobe, how it assesses or actually skim through a data. Like that, a machine actually skim through a data in a very strategic way in order to produce a output which is of more abstract value or lateral thinking. So this is done by extensive training of the machine with similar data. That means we have to pull the data to the machine multiple times so that it can understand or pick up the pattern within the data. So this is how a third wave contextual adaptation AI network works, right? So why are we learning this very deep type of AI here? Because this is very important in understanding the social media addiction. How? Now, So there's a computer, okay, or an app or a social media. It interacts with the user and causes changes in the behavior, attitude, motivation, compliance, and finally, it also impacts the worldview of the person. For example, people who are obsessed with the controversies, for example, whether the globe is round or flat, whether the sun revolves around the globe or the earth revolves around the sun. These are people tend to kind of read this controversy, right? So what happened after understanding his searches, okay, in the kind of search box, the machine understand what kind of person he is. A person who loves controversies. So what happens? So the media, the computer tends to feed so much things about the controversies about a particular topic. What happened after reading so much about that controversy? He develops significant paranoid or a positive opinion about something. So a computer or social media app, by interacting with the user, it causes changes in the behavior, attitude, motivation, and compliance and worldview of the particular person. This is called persuasion of a particular person's. And those gadgets which are doing those persuasion are called as persuasive computers. Okay, so we understand this slide very well so that we can understand how social media usage become an addiction. Okay, now social media addiction group. Okay, now for example, my name is Noorul Hasan. Okay, so I am signing into a particular social media. Okay, now with the second entry into the same social media, the Facebook media will understand something about myself. It will send a random feed to me. Okay, so I will get shares by my friends, relatives, my institute, okay, and many promotion advertisements. So what and all I have seen, what and all I have liked, what and all I have shared, okay. So the analysis of views, watches, the peeping, likes, dislikes, share, time spent in each video, celebrities interested, issues interested, okay. So after analyzing this kind of components in my usage of Facebook or any other social media, the AI-based personalized feed will come. For example, if you have seen, for example, there was one example. We were discussing about one movie of Kamal Hasan. Okay, there's the movie named kind of Virumandi. So it was a very interesting movie. So I was searching about something about Kamal. So from that moment, for another 15 days, I was getting something about Kamal Hasan, about all his controversial films like Virumandi or Tevar Mahan or the Heyram. So all of his controversial movies are kind of feeds I'm getting from the Facebook and YouTube also. So that's how the Facebook media or social media understanding my interest, it creates a model how Noorul Hasan views in the social media. According to that data, it sends specific feeds, personalized feeds. For example, we were 5 people. All of them were searching about Kamal Hasan, but I was the only one who was getting so much of controversial video about Kamal Hasan or the other 4. So that means it has the data about myself, about my usage in the past 5 years or 6 years. Then it sends a personalized feeds to me in order to tempt me to see the video again and again. Okay. Now, so the AI-based analysis of the user's personality is happening. Okay, they will understand my personality through 500 actions that I had done in the social media. So if you have any friends who is working in Google or any of the social media forum in R&D, then you can ask them. There is one lab called Persuasive Human Lab. That means how to tempt someone to make them to see the video that they are sharing that or that they are promoting. Okay, so the media has taken significant analysis about my personality. Now it is going to share significant amount of similar feeds to me so that I can see the video or shares again and again. Okay, so it is persuading my behavior and affects my character or my worldview. Okay, so that I am seeing the video again and again. Finally, it ends up in binge watching and dependence. For example, when I am going to bed, I have to take my mobile and I have to see a Facebook or YouTube for about 1 hour, then I will sleep. That become a routine. So it has changed my routine from a kind of no usage of social media to average utilization of social media for about 2 hours per day. I have a question. Why this social media helps me so much in terms of what I want to see, how this person is? Anyone want to answer? People can unmute and answer.
Yes. Yeah. For me, like what happens is, I will be having regular routine which makes me to see social media and then WhatsApp and then answer. Probably like I'm in charge of few things where I have to watch WhatsApp and then answer few. Respond to many queries. When that happens, maybe if there is a gap, it makes me look at other things so that I stay there in the same phase and then continue with my responding procedure. So
Okay,
this
my
becomes a
question is,
compulsory procedure which pulls us in.
yeah. So my question is, so did we pay anything to download YouTube app? Did we pay anything to download our Facebook app? Did we pay
No,
anything to our Instagram app, Snapchat, WhatsApp?
no,
Nothing.
nothing.
Then why it is taking so much of an over responsibility to make myself easier to view my interest? Anyone?
So may I?
Yeah, go ahead, go ahead.
So because this is also a business, every time you see a video and therefore subsequently related video, what happens is that the ads are prompted in between, which are also related to the specific interest. Every time you click on the ad, the company is getting money and making money out of it. So this is a whole business of digital marketing.
Exactly. So that is the sad truth. So the whole concept of the human persuasion is happening in order to promote their advertisement. Okay. For example, there is a celebrity called Janvi Kapoor. Okay. So Janvi Kapoor is going for a kind of a beach trip or a Maldives tour. Okay. So this will be sponsored by some kind of company. So in return, they will get hold of copyright of the photos. Okay. Then they will plan to release those photos in a particular day. Okay. So they will get ready with all the photos of celebrity and people are just ready, tempted to watch it. Now they will just liaise with the company, for example, Amazon. So they will send a mail to Amazon that we have such video and we are going to release on tomorrow at 5 p.m. For example, the Rajini's teaser came, the Coolie teaser. So for as soon as the release of Rajini's teaser, how much will view that? At least 20 crore of Indian population view that, right? So they will decide to add some advertisement in the initial part, that is 5 seconds or 10 seconds. So they will send a mail to the manager of ad exchange department of Amazon. Okay. So he will decide upon what ad need to be promoted. For example, depend upon the time and festival, they will promote whether we have to promote a grocery or we have to promote a technological tour or something like that. Okay. Because all the people who are going to see that video will initially see the advertisement first, followed by the video next. Okay. So this is the whole point of persuasion of your behavior. Okay. This is a core understanding about how this addiction loop happens in social media. For example, this social media addiction is not that much easy. Okay. This is very important. For example, so after the tenure of Obama was getting over, so the next candidate was, the Donald Trump. Okay. So he planned to make a big campaign in the social media. For that, he had literally signed a liaison or agreement with a company called Cambridge Analytica. So actually, the company is currently closed after this issue. So Cambridge Analytica in turn liaised with the Facebook. So it will ask the Facebook to transfer data, okay, about the users of the USA of the particular area. So the Facebook has transferred the data about the particular person in different domains. So they have thoroughly understood, analyzed the data, and they planned to share a specific feeds to the people in order to attract themselves to vote for the particular candidate. So this was a campaign done in the Facebook in liaison with the Cambridge Analytica. Later, it was taken as the international case, and it is still going on. Okay, so with that social media work, we can actually win a campaign. We can incite someone for issue. We can incite someone for a revolution. We can incite someone for the fight or protest. So the social media aids in many good and bad things in the community. So that's how the social media addiction loop works. Okay. So that means the data is the next oil. So by understanding data, the people, we can handle the people. So how the way we want them to handle. Okay. So data is not a simple entity. So through that data, we can actually handle people. We can actually persuade their behavior. So it's not simple like we are simply using a mobile phone. Rather, we have 1,000 people working behind our screen now to make ourselves addict. So this is how the artificial intelligence works in order to make someone addicted for the social media use. Now, so what happens here? So initially we were doing, and now the machines were doing at the cost of losing our creativity, reasoning, and we are almost becoming verge of becoming autistic animal, because almost all the activities, reasoning done by ourselves was done by the machine. So these are some kind of a backlash with the advancement, human advancements to artificial intelligence. Now, how do we treat? Okay, for example, if you want to treat a depression psychotherapy, we have a very strong model. The Beck's depressive model is there. And if you want to treat obsessive compulsive disorder with psychotherapy, we have something called Salkowski's model. If you want to treat social media through psychotherapy, we have something called Clark's model. So like that, we have very structured models for doing psychotherapy for particular neurotic disorders. Okay, but do we have any structured therapy for social media addiction? Anyone? Any psychologist, PhDs, MPhil, MSc psychologist? Anyone want to?
What about exposure response prevention?
No, ERP is not actually indicated for social media or internet addiction. ERP is mainly meant for OCD. That is the psychosis model. Anyone want to answer? Is there any structured psychotherapy intervention available for social media addiction?
Can we use CBT?
We cannot use CBT because not every people who are using social media have the cognitive distortions. Not every people have distortion, or not every people have automatic thoughts. So by doing CBT, what will we address? If the patient doesn't say that I don't have any kind of cognitive errors with myself, then how do we do?
What if the addiction is due to FOMO?
FOMO means the fear of missing out something.
Yeah.
And that is more of a preoccupation, not a particular addiction. If you go to FOMO, there are many things. The entertainment addiction, content gratification. There are so many things are there.
No, I'm asking is due to FOMO, the amount of time spent on social media increases, which can lead to addiction?
Yeah, that we have to assess whether the man uses the social media in order to share his image or peep into someone's profile, or for content gratification or for entertainment. We have to assess those.
Yeah. So when that can happen in maybe in a small proportion, like if the amount of time spent on social media due to FOMO is more, that really that may have connection with the cognitive distortions.
Yeah. I may lose information. This is the cognitive distortion you can get.
Yeah.
For example, people who are anxious avoidant person or socially anxious person, they may not be having much friends in the offline. So they feel people will embarrass me in the offline so that I can enjoy myself in the online. So this kind of cognitive distortion you can get specifically in particular persons. But like OCD, will we be able to derive a structured therapy for social media addiction? Difficult. Yeah. So if you go through the literature in detail. So
what about hypnotherapy?
Sorry?
Hypnotherapy?
Technotherapy. Can you explain a bit?
They use hypnosis for this kind of addiction.
Hypnotherapy.
Yeah.
Hypnotherapy. I think hypnotherapy is actually not at all in practice nowadays. Very rarely used by the older psychiatrist. Okay, and with the current era, I have only once done my hypnotherapy with my patient. After that, I didn't do.
Sir, if I may.
But hypnotherapy is not a psychotherapeutic model. I'm asking about a structured psychotherapeutic model for social media addiction.
Is it a scale or therapy like?
Therapy like CBT, DBT, psychodynamic therapy, mindfulness.
REBT works out?
Rational
emotive behavior.
Yeah, the answer is we have to do some kind of an eclectic work. Depend upon the personality, depend upon the cognition, okay, depend upon the impulsivity, depend upon the mood dysregulation. We have to mingle everything from a basic activity scheduling of a day, cognitive behavioral therapy, then we have to preach mindfulness, then abstinence. So we have to do many things. So why I'm just pressing on this point is our therapy skills are actually falling short by miles. The gap is actually so much because those addictions were completely backed by artificial intelligence. For example, OCD is not backed by AI. Social anxiety is not backed by AI, but social media addiction or internet addiction is completely backed by the AI. The AI will grow by every 6 months. The people who are working in the persuasive love come up with new ideas in order to make someone addict. They will come up with the ideas with every 6 months. So the problem is we may not be able to conclude with a single structured therapy. Rather, we have to go for a thorough assessment about the particular domain which is deficient or getting abnormal. Then we have to devise our plans in the more eclectic way possible. For example, we have to, as a routine, we will assess the severity of the addiction. Then we have to understand the extent of intrusion into the personal life. Then individualized and parenting-based interventions for a child. Then controlling the internal and external triggers. Then apply the IPS model, the personality factors, affect factors, cognitive factors, and executive functionality factors. We have to understand all this. Then we have to intervene according to deficits in the each domain. Then ADL assessment and structuring the same that will kind of almost make him abstain from frequent usage. Then understanding the cognitive distortions for a particular people. For example, in order to challenging their FOMO fear, then assess the stage of motivation. Then we have to go for the RPT. For example, the need for immediate gratification, abstinence violation effect. These are the domain that we have to address. So we don't have a structured therapy yet, but people who are working under mobile will have a structured ways to make myself addict. So this is a very critical thing that we need to know from the social media understanding. So this is very difficult to treat. For example, if you actually ask some 100 great PhD or clinical psychology therapists, you can ask what intervention did they do with their patients. Very difficult actually. Okay, so yeah, so now this is a very kind of a structured way of handling the patient with social media addiction. Okay? Now some well-being tips. So the solution is not the gradual abstinence.
Can I ask something?
Yeah, please.
Just out of curiosity, like we have recently a center opened in NIMHANS, Bangalore, which is exclusively for the social media de-addiction.
Yeah, there is a separate OPD running in the NIMHANS for that.
Yeah, very separate OPD, and this is one of its first kind in India. Like we have a rehabilitation center, drug abuse, de-addictions, and all. So this is first of its kind in India. Like we have a social media de-addiction center which is opened in NIMHANS, Bangalore. Yeah, and for the last 2.5 level, it is with an institution and able psychologist and psychiatrist at NIMHANS. So can you tell me, sir, what will be their strategy?
So there also
what structured therapy they will be using?
So that's what I'm
telling. No, I'm asking what therapy they will be.
Sorry, I'm actually, you are not audible. Your voice is missing in between.
Hello, am I audible now?
Yeah, please.
Yeah, so I'm asking like,
sorry to interrupt.
Sorry
to interrupt. That's AI. I was checking with AI whether hypnotherapy could be used for social media addictions. It says yes, it can be. It is very useful, and it has listed a whole lot of options.
Yeah, I think we will discuss that after the end of the session. Let me complete my 2 slides in the end. Okay. So these are the see if you discuss with any psychotherapy specialist or the people from NIMHANS, because I myself did my MD from NIMHANS. So when I was there, also the clinic was actually actively working. Okay. So these are the ways we usually strategically, structurally assess the patient, and we will address depend upon the type of background issues they have. Okay. Now, some well-being tips. Okay, so for stopping social media, there is no protocol of gradual abstinence. The rule is cut off completely. The complete abstinence is the rule. So use YouTube Premium with the history turned off. If you, for example, if you can open your YouTube. Okay, so I can open my YouTube live now. Okay, this is my YouTube. So if you want to see, okay, I have opened my YouTube. Okay, there is no dashboard in it. There is no fed videos in it because I have opted for YouTube Premium and I have kept my history off. So if that is the case, there won't be any feeds for you. If at all you want to see something, you have to type in the box and you have to see. There will be no dashboard. There will be no existing videos. Okay. So it won't tempt you. So it will save your time so much. So the rule is a complete abstinence. So use YouTube Premium if anyone wants. Then move to print media, follow one online news media via the website or WhatsApp notification rather than reading their own kind of shares from the Facebook media. Then you will feel boredom at the start after stopping the social media use. Your FOMO will be actually threatening you that if you do something, you will lose your knowledge like that. So you have to control that for some time. Then prefer keeping the mobile mostly in pocket instead of taking the mobile in the hands. For example, you'll be drinking a tea simply without reason. You'll be just taking the mobile. We'll get some temptation to touch the Facebook icon. We'll get some temptation to touch the WhatsApp icon. So instead of taking that in hand, you can keep the mobile in pocket. That will save a lot of time. Then challenge the urge to post their sorrows, emotion, and their personal stories on social media. That should be avoided. We have to properly give guidance for that. Control your urge in touching the reels or shorts button. Okay. As soon as you are not touching, you won't get addicted. But as soon as you touch, then you slowly get addicted to it. Then curb your FOMO or anticipate it. Yes, I may lose some knowledge, but it's okay. Instead of losing 4 hours, 5 years of my day in a day, 4 hours in a day, I can lose some knowledge. No problem. That won't affect your academics or your career. Then use desktop or laptop for content gratification. For example, if you want to read something, use your very well use your kind of desktop than using your mobile phone. Then use mobiles when necessary. Absolutely no problem if you miss some messages or not replying to someone. Don't get preoccupied with it. Then screen time. People say the screen time should be reduced to 60 minutes and 120 minutes. See, if from my reading, if you want to stop social media, then stop it. Cut off completely the screen time. There's no proper guideline. The recent definition of health, actually, in the end, we have very big definition for health previously. Now, I think this is from the Institute of Medicine. The health can be defined as enthusiasm to work in the morning and the compassionate to help others. I think with significant social media usage, both of the domain will get affected. Okay, this is a very interesting book. Okay, before going to that book, I will use another book called The Dopamine Nation. Okay. If people are interested, they can they should read that book called Dopamine Nation by Hannah Lemke. Okay, and this is another book, The 10 Arguments for Deleting Your Social Media Accounts Right Now by Jaron Lanier. Very interesting. Okay, so he will make his arguments that you don't need social media for knowledge dissemination or content notification. This will not improve your knowledge identical. Rather, you can fill your gaps at the times of boredom, and it can fill the gap at the time of your emotional turbulence. Rather, it will not help you in terms of the knowledge dissemination. Rather, we have many other modes to kind of gratify the knowledge requirements. And finally, one slide about ChatGPT. Okay, so when ChatGPT was asked about gamma knife therapy for a particular tumor called vestibular schwannoma, it just say the answer in a minute or a second as precisely as possible, as like someone who read the vestibular schwannoma in a detailed amount. Okay, it is giving a very much abstract and up to the level concept about schwannoma in a second. Okay, So what the doctors in John Hopkins did, so they challenged the ChatGPT with a question paper from the Congress of Neurological Surgeons. So they actually given the MCQ of the recent neurosurgery paper to the ChatGPT. Okay, it scored 60%. But the average score scored by the doctors who attended the exam was 69. So what does it say? ChatGPT can give information, knowledge dissemination as much as possible. But as a human being, the most unique things are the rational thinking, soft skills, and personalized treatment decisions are the pillars of any psychiatry or clinical practice that cannot be replaced by the artificial intelligence. So with that, I'm ending my presentation here, and my acknowledgements to Dr. Thomas and Dr. Lakan Shukla of NIMHANS Bangalore. Thank you. Thank you.
Congratulations, Dr. Noorul Hasan. It was an eye-opener for many of us. Very interesting new presentation with lots of informations. And I think most of the professors, they will agree with me. Some of the tips that you gave to deal with the social media addictions are very, very relevant. It's a challenge that all of us are facing, not only in our personal life, but also it has become an illness in many of the educational institutions, because these days we see students, they are so much addicted with social media. You walk out, they are looking at the phones more often than to look at the companions or the teachers who are walking along with them. Like, so your interventions are are very interesting. Yeah, I personally liked it so much, and I believe that maybe questions from the participants.
And one more information, sir. Thank you, sir. Thanks for your great words. And one information, actually, I started, artificial intelligence is not my area of expertise. Rather, out of interest, I started reading about the social media addiction. I was reading many books related to that, and I was seeing some documentaries in Netflix, like The Great Hack, like that. There are some great documentaries related to this. After reading that book written by the Jaron Lanier that I have previously shown, I stopped using all the social media right now. So I'm not using Facebook media. I'm not using Instagram. So previously, I was using about 3 hours a day at least. Nowadays, no Facebook. I am not at all reading any foreign messages in WhatsApp. And YouTube also, I have applied for the premium. So I won't be tempted with many videos. Rather, if I want any video, I have to literally type and see. Really, it helps me a lot in saving my time, increased my time spending with the community or family, or at least for myself in reading. So stopping social media will make yourself wonder about your own personality. This is my personal experience after learning through this.
Very true. You connected all the factors so coherently, beginning from biological factors and coming into the psychological factors and social media and artificial intelligence. So it was very well connected. In fact, I was sharing with Dr. Vimal, who is our chief technical expert. I was sharing with him. I don't take my phone to my restroom or my bedroom, so I keep it on the table. Like he said, it's a wonderful idea. Like you said, I'm not part of Facebook or Instagram or anything like that. I WhatsApp and YouTube. YouTube, I watch the news, but otherwise, I am also because I save a lot of time for doing other things. Like I can resonate with your ideas, and
thank you, sir. Thank you. Yeah. Thank you.
Doctor, can you hear me?
Yes.
Yeah. That was a good presentation. You told that you are not there in social media and any of the things, but in the recent days, right from a small child to elderly person, we are so addicted that without taking the rectangle bigger size tablet, we can't sleep. That has become the order of the day. So when you want to inculcate this kind of habit to the youngsters, what would you suggest? to stop avoiding the social media and all those other things, because youngsters are very much into this addiction process.
We actually, I am saying that I am not using the social media. Okay, that thought with a pinch of salt, because we may not be able to overgeneralize this attitude with every people in the world. For example, people who are staying in the abroad, okay, alone without their families, for them, the only connection with the native or the world is the social media. So I may not be able to say to them that you have to curb all your behaviors in terms of using social media. This is one side. And in terms of youngsters, so number one, we have to understand their triggers and the precipitating factors. We have to understand that first, their temperament and personality. After understanding that, so the one thing that we have to do is they have to keep themselves busy. Okay, they have to plan. They should be motivated for that. Then we have to make an activity scheduling. That is the first step in terms of controlling the social media use. Without keeping ourselves busy or without making ourselves very scheduled, completely abstaining from the social media is actually very difficult. So, stopping social media or kind of doing therapy for social media addiction to youngsters is actually completely very much personalized task. I may not be able to give a blanket answers for this. That's what I was discussing about. Was there any structured therapy model for social media addiction? So we may not be able to do it. So we have to understand their basic precipitating factors, and according to that, we have to nail our therapeutic principles.
Yes, sir. Thank you so much.
I know you may not be able to satisfy with this answer, but that's the truth.
Of course.
Doctor, hello.
Yes, sir. Yes, sir.
Yes, sir. Sir, what is your idea about neuro-linguistic programming?
Yeah, I understood. NLP, many people are doing. Actually, it helps many people. Okay, those people who are not aware of so much of the neuroscience concept, basic concepts. For them, actually, NLP is actually helping a lot. So I have attended a portion program about NLP. I think conducted by someone named Hussein Basha. So he's actually a very good trainer. So I attended that. It's actually very good. People who attend the NLP by him, or there are many trainers are there.
Okay.
People gave good feedback, and they also take a good feedback for their life to follow. But as a psychiatrist, I cannot convey that as a therapy principle for any particular disorders. I'm able to.
Thank you, sir. Thank you. Thank you.
Hello, sir. This is Shama. Hello. Hello,
Yes,
sir.
yes,
Doctor. So we have some contrary popular beliefs that video games can also have positive effects on children's brains. So certain studies and some videos have shown that playing video games can improve cognitive function, including memory, attention, and decision-making skills. So video games can enhance problem-solving abilities through the simulations, and they can whether they can expand their neuroplasticity, or is it okay to allow children to permit them to use social media systematically, because it is very much inevitable and inseparable for this Gen Z, because they may feel inferior if they are totally deprived of this social media and the gadgets. When they interact with their students, peer groups, they feel inferior, not knowing the updates of all the apps and the goings of the social media. So how do we, if there are any advantage, we can allow this to some proportion?
Yeah, number one, for people who are indulging so much into the games, then we have to advise them to curb their usage to a restricted period of time. That's one thing. Second thing about video games aiding in increasing the cognitive potential. Yeah, absolutely yes. One of my colleague named Bhavika has written a very good review on the implications of gaming, okay, in our day-to-day life. So there are many implications, and we have one very famous gaming app called Lumosity. So I literally advise Lumosity people to play Lumosity game whenever I find issues with their cognitive function, decision making, set shifting, or response inhibition, like kind of issues. So as you said, this kind of cognitive enhancing games fantastically help in people to improve their cognition in many aspects. That's a point well taken.
Thank you, doctor.
Yeah, thank you so much, Dr. Noor, for your presentation. It was wonderful. And starting from evaluation of medicine to recent psychotic disorders. Okay. So here the question is addiction. Okay. And as a therapist, I feel that due to stress and depression, people addict to so many things. So, like the social addiction, so if it is necessary, they are going to give their own priority, right? Like after giving a session to the people individual, suppose if they are like they're able to cope up with their life, cope up mechanism. So this addiction I found from people like escapism part, like I'm not able to take care of certain things, or I don't know to what I have to prioritize. So like again they become addict, and as you said, they face their psychotic disorder and later they are not able to come out. But once rehabilitation, so many things. So this even alcohol addict also, like once the people are like psychoeducation, or like we help the people to come out from their stress and depression. So I feel in my experience, the addiction is coming down. I'm very happy to share with you. Like, social people, I don't think they are always with the WhatsApp, or like they are tempted to watch. Even the younger generation, okay, even the kids and the students also. Like, if really they have interest, they want to learn something, they just open up. Or otherwise, the things are changing now. So the main cause for the social addiction, I personally feel, it's whether it's a kid, whether it is 3 years or like 80 years, because due to their own stress, they are not able to cope up things. So, and they are finding this is the very best thing to escape from certain things, maybe responsibilities. Am I right? I don't know. It's my own.
Yeah. A proportion of individual can have this kind of a comorbidity. So they have underlying syndromic comorbidity like depression or anxiety, and they will end up in consuming social media again significantly. For example, today I have seen one patient. He's a very difficult patient. I was exploring the trigger. So he was telling us about his activity schedule, and he was using 4 to 6 hours of social media. Then I slowly turned into his path, and he told, "Sir, there is an issue in my past and present. People sometimes comment me about my way of gestures that I'm not straight."
30%.
So
Thank you so much, Dr. Noor.
that significantly affected his personality. He completely cut off all the social connection with the surrounding, and he ended up in the solitary mode, and he was consuming social media significantly. But after counseling, or after a kind of eclectic work along with the kind of medicines, actually the social media use actually kind of down. So as you clearly mentioned, if we can pick up the underlying etiology or comorbid issue behind this addiction, actually it will improve a lot. So in second, there is a dictum: if any issue which is secondary, it will improve very fast. But if it is a primary, then we have to do it fast.
And one more thing I would like to add, thank you so much, Dr. Noor. Even I tried AI for my PPT. Okay, trauma of the unborn child. So I've gone through the slides, and later I felt that something is missing there. And I started preparing my own. And finally, you just concluded, no, 69%. Like 60 AI and 69%. That's wonderful. So now, more than AI, we can do something.
Yeah,
So
exactly.
there's a belief, no, you have given to us. Thank you.
Yes.
Thank you so
Thank
much.
you.
Yeah.
Thank you, madam. Thank
So may I ask a question?
you. Yeah, if time permits, you can.
So do you think that social media is also responsible for making people emotionally vulnerable? Like, is it not deliberately putting words in their mouth, or to make them feel in a certain way? Because I mean, there is also um, people speaking up is fine, but then losing out on values because it is so nice and it is so much in vogue to act vocal on social media, and you're being kind of instigated, and you carry the same or translate the same to your workplace, to your family. And this is more in case of younger people, like adolescents and younger adults. So is it not making them fragile emotionally? because mental health is fine, but I think these days mental health, talking too much about mental health has also become a fashion kind of thing. I mean, somebody not able to qualify, they claim there's something wrong in their mental health because they go on social media and read stuff like that, and it is so much free.
It is 100% true. For example, there are some very important people who are involved in politics. So until the results are coming, they will be completely preoccupied, not with the type of result. Rather, they were fed up with the discussion happened in the social media about one party, a kind of alligating another party. So those overnight discussion making them more fragile and vulnerable. Okay, so 100% social media discussion will make yourself fragile and vulnerable. That's true. So here, one thing I want to say: so using social media is not a wrong thing. Okay, but social media use becoming which is compromising your BSO function. That means the biological, social, occupation function. That is a problem. So not every social media uses an harm. Okay, that I want to make things clear, because for some people who are alone in the abroad, that is simply their breather to understand what is happening in the world. Okay, that's one thing. Second thing, the amount of work actually put behind your screens through thousands of the IIT returns from people from IIT or IIM, they're doing an extraordinary job in order to persuade you. So 100% your emotional or your decision capacity may not stand with their way of using the AA mode to persuade you. So you cannot win them. Rather, the rule is abstain. So if you feel that your emotion is damaged, you are becoming fragile, then the rule is abstain completely, because you cannot win them, because there are thousands of people working in the persuasive lab in order to make you study. So you cannot beat them. So just abstain, you will win. That's it.
Dr. Noor, I have
Yes,
one
ma'am.
question. I'm from Mizoram, Patsua
Yes.
University College. I have heard many times people saying that one addiction could be replaced with another kind of addiction. What is your take on that?
Might be hypothetically yes, but I may not be able to explain the more structured way through an evidence base. So, but for any kind of morbid addiction, healthy addiction is the rule. We have to replace that with the healthy addiction. But that replacement, the one that we are going to replace with the existing addiction should be much stronger in order to motivate them to quit the previous one. So if you are unable to make such a strong motivating factor, we may not be able to pick them into this another mode of healthy addiction. So this is a very so I can hypothetically say yes, but
Yes.
out of literature, I may not be able to say yes.
Okay, thank you.
And since it's a very relevant topic, all of us are in one or the other way, we are all affected. Like as parents, we don't know what to do with children who are addicted to social media. And as professors, we struggle with students, asking them to focus on the studies. Like so, everybody since everyone is struggling, I find it's a very relevant topic, and you have addressed it so well. Participants, if you have any other questions, we can ask doctor. Otherwise,
yeah, I think we can move for the closure.
okay. Over to MC.
Thank you, Doctor. Thank you for an insightful session on the impact of social media on mental well being through the lens of AI. We are grateful for your expertise and practical insights. And thank you, a heartfelt thank you to all the participants for your active engagement and enthusiasm throughout the session. And I thank Dr. John Balaya, the IFDP coordinator, and Dr. Vimal Gerald, and Dr. Bastin Tyagaraja, and Ms. Christiba for for making this session more interactive and successful. Thank you, sir.
Thank you.
So thank you, doctor. There were one or two people who want your PPT. Will it be possible to share your PPT?
Yeah, I have already shared my PPT to your mails. You can actually share it.
Okay, you can share. Yeah, you can share it in my WhatsApp.
I already shared.
Sure. Thank you very much. Yeah, and have a great day.
Thank you,
And
sir.
we appreciate you taking time off
Thank
and
you, sir.
spending your precious time for the cause of education. We appreciate all your services, Doctor.
Really,
Thank you very much.
I am so much indebted to present this great forum, St. Joseph team, and thanks for considering me in this forum. Sir. Thank you.
Thank you, Doctor. Thank you. Have a good day.